I think we have to take the evidence that has been compiled over the last decade, where we now see that if we take application of many of the solutions that we've recommended years ago, the Children's Defense Fund, the Select Committee on Children, Youth, and Families, various nonprofits, that we can really change the outcomes for almost all children. Early on, we were discussing the consequences of the absence of programs to treat children and to deal with problems of families and young children. And when we looked at those consequences, we started to amass the research of how could we have a positive impact on these consequences of not being able to go to school, or not having access to early childhood health care, not having access to maternal care. And how do you do this and put this together? And we've now learned how to do it, and now it's a question of implementation. So we've come a long way from the consequences that were abhorrent to so many people in America. How do we treat this? How can we research this? How can we get the best outcomes? To now having that information and putting it in place in terms of income supports for families, in terms of access to health care, no matter what your age, no matter what your status in America, your access to education, your access to a quality education. It's now quite within our means to develop a quality education in every school, in every schoolroom, in front of every child in America. It's a matter of the will. And so the campaign really has come to the last lap in terms of getting these programs implemented, because the cost benefit is so huge for the government, for local government, for state governments. That's why you see governors running out and embracing early childhood learning. If they don't embrace it, they can't get the outcomes they want in K through 12. It's not complicated, and they can just keep spending a lot of money with no results. So it's really interesting to see this bipartisan motion moving across America, just as mayors and governors are raising the minimum wage. They know they can't have a thriving community if people don't have resources, if it's built on the backs of poor people. So think how far we've come, and now it's not the time for people to falter. We're here where we get to now reap the benefits on behalf of these children, on behalf of these families. And as pointed out in this wonderful book, this is how we can improve the odds for success of each and every one of these children. Talk about exciting. We used to lament the problems. Now it's about the solutions that are within our grasp. But what's so troubling now is when you have this compelling evidence, when you have the compelling research, when you've seen the evidence being applied successfully on behalf of children in early childhood education, in early access to health care, in early access to mental health care, early access to nutrition for pregnant women and for her child, and the changes we've made. These are real answers that work, and yet at the same time, they're on the floor of the House of Representatives with the Ryan budget to strip these programs of the resources for their success, for the success of these children and families, and somehow transfer those dollars to the wealthiest people in the country. It's just bizarre, especially when the evidence and the research has been so compelling that CDF has worked on for so many years to really say, let's do the work that doesn't shortchange any child, any family, and let's make sure that we can get the outcomes that we expect and that we need as a nation. This isn't speculation. This isn't speculation any longer. So now it is a matter of resources, and the struggle is over those resources. Should they go to the wealthiest people in this nation, or should they go to those most in need, where we can have the greatest chance of success, that they too will be a full participant in American society, in American democracy, and the American economy?